The reason we've invited you into our office today is to discuss with you a recent publication we've just had published in the International Journal of Dentistry that has a great impact on your patients now they're being treated in our office. Hello, my name is Dr. Gary Lyons and this is Dr. Don Hoagland. And we'd like to discuss with you today a revolutionary product that we have called platelet-rich fibrin. It has eliminated most of our dry socket pain for your patients, and they will love you for referring them here to have this treatment done.
Gary, thanks for the introduction. You know, since Gary and I moved our practice here 13 years ago by Arrowhead Mall, we've always tried to be a progressive practice, be it from introduction to digital dentistry, cone beam technology, third-party softwares, and also using products such as biologics. And the latest biologic that we use in our practice is a biologic material called platelet-rich fibrin. We're going to spend some time today explaining how well it makes our patients heal and how excited we are to share this finding with you.
Welcome back. We appreciate you taking a few moments of your time today to spend with us showing you these incredible results that we're getting with platelet-rich fibrin. As Don has listed on the screen, some things about platelet-rich fibrin we want to share with you.
Yeah, thank you, Gary. What platelet-rich fibrin, what the PRF stands for is platelet-rich fibrin. And essentially what it is, it's a fibrin matrix with a platelet concentrate. The platelets contain certain granules that release growth factors, and these growth factors stimulate bone, soft tissue, and also vascular ingrowth into our surgery sites. When we place the PRF into a surgical site, it acts like basically a powerhouse and draws in new cells called mesenchymal cells that can be transformed into cells that we need to ensure the patients heal properly. The first person to speak about this is actually a French anesthesiologist, Dr. Corkin. He first published this information in 2006. When you look at extraction sites, and in a normal extraction site, about 94% of the cells in the extraction site are going to be red blood cells. Those do nothing really to help us heal. So what we want to induce into the site is more platelets. By placing in the platelet-rich fibrin, which has the platelet concentration in it, we place it into the socket, displaces the number of red cells, and we have the cells that initiate healing. When we make this product, we do it in the office on a medical grade centrifuge. We spin this down for about 12 minutes at about 2,700 RPM. When we do finish the product, this is what it looks like. It's basically, the blood tube contains a top layer of platelet-rich fibrin, a middle layer which is called the buffy coat, which is the highest concentration of platelets, and the lowest area in the test tube is going to be red blood cells, which we don't need to use in our process. So we just retrieve out the platelet-rich fibrin clot, and then we can mold it and use it however we need to use it. And some of the common uses that we use PRF for would be to help prevent dry sockets from forming. Now you can see this patient is about 1 week after we remove a partially erupted lower third molar. The socket base is very shallow, the patient healed very well, and had a very nice outcome by using platelet-rich fibrin. As was shown in our study, we reduced dry socket rates over 90%, which is unheard of. We got incredible results with this. We had a dramatic decrease in post-operative time, so that means the lesser amount of time it took us to manage patients who develop dry sockets. Patients are happy with that because they don't take time off work to come back and see us, and we're happy with that because we got to do the surgery in a simple, straightforward fashion, and they healed very nicely. We also, by using this technique, we don't put any foreign bodies into the extraction sites. That's why they heal so cleanly and so well. But I'm going to have Gary now share some other usages of PRF, and he'll go over those cases with you now.
Some of the common things that we've used PRF for in our office is, as you see in this case, the patient had an area of dehiscence around the lower incisors. The soft tissue graft was done taking the donor site from the palate. Platelet-rich fibrin can then be placed in the donor sites, and you can see what incredible healing you have just in 10 days from this soft tissue surgery. Another case, the patient was at another provider, had a tooth extracted after they expressed sodium hypochlorite into the soft tissues. The tooth was then removed, and then a fracture was made through the palatal aspect of the alveolus and exposing the maxillary sinus. All that was done was a little cleaning of the wound, debridement, and platelet-rich fibrin was placed in the extraction site. And then you can see 1 week post-operatively going to 2 weeks, you can see the amount of soft tissue healing. And then at 3 months, not only does we have excellent soft tissue healing, but the bone has actually regenerated within the socket site itself. Commonly, when we use this at extractions, we take teeth out, we'll do a bone graft, then we'll place the platelet-rich fibrin in here, and we'll suture. You can actually suture this down, and it will not tear. It provides a great source of healing for the soft tissue and regenerating the tissues we're going to need for aesthetics. Here you can see two cases. The one most specifically we like to talk about, this is a 92-year-old female who wanted to have an implant. So we told her we need to extract the tooth there and do a bone graft. We placed the platelet-rich fibrin. This is exactly 1 week post-operatively. You see almost complete healing of the soft tissue. It's incredible in a 92-year-old that you're going to see this kind of healing result. This next case shows a dehiscence of the root of tooth number 8. Debridement was done. Gem 21 was placed in the area with platelet-rich fibrin being sutured over the root. And you can see again in 18 months, incredible results with this type of material. No donor site was needed, which is an added plus for your patient. Socket preservation is most commonly where we use platelet-rich fibrin other than for prevention of dry sockets and wisdom teeth. Extractions are done, bone grafts are done, and then the soft tissue is covered using the platelet-rich fibrin. Another area of practice for us is treatment of patients on bisphosphonates, or like this patient who had florid osseous dysplasia. These people have very compromised bone, and any type of surgery on them, they will not heal properly. Platelet-rich fibrin allows us to place this in these defects and get a very good vascular soft tissue healing response, such as placement of the platelet-rich fibrin sutured into position like you see here.
Well, thank you, Gary, for the explanation. And as Gary said, once that platelet-rich fibrin is placed in the socket of this patient has really poor bone healing capability, the soft tissue will go right over that area and protect our underlying bone and prevent secondary infections. Again, platelet-rich fibrin has been such an incredible adjunct to our practice and how our patients heal. It's been a revolutionary finding for us, and also we're very thankful that we actually had our study published in an international journal.
Hi, I'm Joni. I just had 2 wisdom teeth taken out last week, and I just wanted to share my experience. No dry sockets, no pain, no nothing. Dr. Lyons is wonderful, his staff is super, the office is great, and I just, people get so nervous going to the dentist and having these things done. And I just, like I said, I had no pain or anything, so I wanted to share that with you. Thank you.
Again, let us thank you for your time today, sharing a few moments looking at this video and reading the materials that we provided for you. Again, I'm Dr. Gary Lyons, this is Dr. Don Hogan. We're with the Arizona Center for Implant, Facial, and Oral Surgery. There is nothing more important to us than the best quality care that your patients can receive here, having extractions done, wisdom teeth removal, or even bone grafts and implants. It is our ultimate goal to take the best possible care of your patients.
Gary, that's my sentiments exactly. And we invite you to call us to spend some time discussing the use of platelet-rich fibrin to enhance the lives of your patients. We'll come to your office, we'll take you out to lunch, we can show you some of the things that we're doing. Also included with the information today, you also received a copy of our article. And again, Gary and I both thank you.